To Mpumalanga now, coronavirus has exposed the inequity from schools to public health care. Despite the country moving to level 2, many sectors are still facing challenges. SABC News reporter Tumelo Machogo is standing by to give us this week's provincial wrap. And what does level 2 mean to the people of that province?
Mpumalanga has recorded over 24,000 cases of COVID-19. That's about 3.9% in terms of the national numbers. That number in its own, it's a less number compared to other provinces. But this province is one of the 3 provinces actually that has not recorded a huge number of COVID-19. Only at about 24,000 have been recorded here in this province. But we have seen in this province that there have been peaks and also declines in terms of the numbers that have been confirmed. We saw at the beginning of lockdown when Nkomazi was actually one of the area where it was the epicenter in the beginning of this lockdown, when numbers there were actually skyrocketing. And remember that Nkomazi is one of the rural areas, it's one of the rural part of the Mpumalanga compared to other regions here in the province. But the numbers also went up in other regions. It went up especially in the mining town of Emalahleni. You remember that's where we have a lot of mines and that's where we have a lot of people. It's actually one of the congested area in Mpumalanga. That's where we started seeing the surge there in Emalahleni. Emalahleni is to this point is still one of the highest the epicenter of the province, still have the highest number of confirmed cases in that area. Yes, the number have declined, especially the number have declined in the last couple of weeks and weeks, but those numbers have not declined a lot, but the numbers have declined, especially coming down. The numbers have come down. We have seen numbers coming down, especially since towards the end of level 3 and to the beginning of level 2. We've seen the numbers going down and going down, but we have seen schools protesting, especially parents protesting when the school children started returning back to school. We saw parents that are protesting. We saw in number of areas, especially in Masoi area, we saw in Matsulo area, and we also saw in Nkomazi where parents have actually been complaining, saying that there's not enough space for children to go back to school, especially now that most of the children have returned to school, that there's not enough space for everyone to be actually attending the school, saying that social distancing is a challenge for many of these children at these schools. We saw parents complaining about a number of things regarding water situation, regarding sanitation in those areas. So we saw that parents have actually been complaining, saying that there's not enough social distancing happening at the school, there's not enough water, there's not enough also there's not enough sanitation happening at the school. So we saw protest in Matsulo. Just let's take a listen to this package. There's an anxiety for Vusi Mamba ahead of his return to class. That's because going to school hasn't involved any learning for the past 2 weeks.
I'm going to be prepared enough because we didn't learn enough. You see, many things are interrupted. We can't go to high school because nothing is inside.
The school is just not big enough to accommodate all learners and maintain social distancing. And that has frustrated these parents who are demanding the school make plans to ensure there's space for all learners. It's been 2 weeks of no teaching and learning, but the problem stems from 2 years ago when a fire gutted 4 classrooms. Only 6 classrooms survived to accommodate 668 pupils. Parents want swift action.
We cannot accommodate 668 learners on that 6 classrooms. So we have that problem. We appeal on Minister Machogo to come and intervene on this matter, because until today, we've never saw anyone from the department coming to help us here. So we feel like they are not taking us serious.
The Provincial Education Department says the school has been prioritized for emergency fund.
Encourage the school to look into the option of platooning so that we don't have many learners at once at the school, while we're also looking at the option of providing mobile classes for the school.
Well, we also saw this week NEHAU joining the National Day of Action when NEHAU members, actually most of them were healthcare workers, when they were marching to the provincial offices to hand over their memorandum to the Premier of the province, Ms. Refilwe Mthweni-Tsipane, where actually a number of concerns have been raised by these members. NEHAU members are saying that there is a lot of shortage of staff in the province, especially doctors, nurses and cleaners. They're saying that hospitals and clinics are suffering because they don't have enough doctors and they don't have enough nurses and cleaners in these hospitals. So they marched. There were about 500 of them. We know that there was a huge number of them. They were marching. It was a sea of red, marching around the city center of Mbombela, going to the provincial offices to actually to say to the Premier that they want action. They want to see hospital complying with the health and standard of the country. They want to see that the nurses are being protected. They want to see that nurses are actually and doctors are actually maintaining, and also they're actually being assisted in terms of dealing with COVID-19. They're saying that if nurses are not being helped, these nurses and these doctors will not be able to combat this COVID-19. Let's take a listen to this. A sea of red. Healthcare workers on the streets demanding action from government. Shortage of staff, a major concern, and they want vacant posts filled. The union want adequate PPE for frontline workers and corruption eliminated. In Mpumalanga, 1,112 healthcare workers have tested positive for coronavirus, claiming the lives of 14 of them.
You will remember that by now workers would have been given their increment as from the 1st of April 2020, and that has not happened. Among other things, workers as we speak, the frontline workers, are frustrated psychologically. They cannot perform. Why? Because they are not even given danger or risk allowance. They also work under strenuous conditions because they are not even enough. There's serious staff shortage where they are employed. So there are a number of issues that are also including the permanent absorption or employment of community healthcare workers, who are also a backbone in terms of our healthcare system. So among other things, there are also issues that are outstanding that would have been addressed long time ago. You will remember in Mpumalanga that there's an animal that is called moratorium. We hear the commitment made by the Premier now to say they set and then they resolve and so forth. What we want to see is NEHAU, because you know that since 2016 we have been marching on the street demanding for the upliftment of moratorium so that all departments, including the state entities within Mpumalanga province, can be in a position to employ workers so that these workers that you see here now, they are overworked. And they are also human beings. In that regard, members of the society are also affected in terms of service delivery.
We also saw this week the public protector advocate Vusisiwe Mkhwebane visiting Temba Hospital, actually just to check the compliance when it comes to that hospital. You remember that hospital actually recorded 99 of healthcare workers contracted the COVID-19. About 99 of these healthcare workers actually work in the same wards and work in the same ward. They also contracted the COVID-19, and we saw one of them actually succumbing to the virus. And also Vusisiwe Mkhwebane was here to meet with the labor, meet with the management of the hospital, and also to meet with the unions to hear their concerns about what is going on at this hospital, why there were a lot of cases that have been reported to this hospital. She was also checking if the hospital is clean, if the hospital is complying with the regulations. She was checking on number of issues, especially with the hospital. But the union were actually raising issues that has already been raised, issues of shortage of staff, issues of infrastructure, and issues of non-maintenance, especially of those infrastructure. The hospitals, they're saying that the hospital laundry is full, it doesn't work completely. Vusisiwe Mkhwebane was so disappointed to see that the maternity ward was in that state. She actually said this is one of the worst maternity ward she has ever seen, saying that cannot be allowed because there are not enough beds, there are not enough doctors that are actually helping to help women there. He's saying that can actually have like a huge impact on the delivery of services, especially services when it comes to COVID-19, because we know that COVID-19 has had a huge impact, especially in that hospital. Just let's take a lesson of what Vusisiwe Mkhwebane told me after she has visited the hospital.
Around the hospital, the cleanliness was encouraging. until we visited the maternity ward. I mean, it's so horrible to see. There's no space. They don't have enough beds, and they are saying they have a lot of patients. And I think this is the worst maternity ward, which needs a serious and quick intervention. But then on other areas, the CEO took us through. The unions were also fine because they've raised their issues, and we also asked, especially DPP, asked the management to be transparent and not hide anything, because as public protector we are here not to police or not to find fault, but we are here to check what are the challenges they are facing, the challenges during the pandemic, and how can we recommend speedy resolution issues which they can start with, or quick wins issues, so that it can then have an impact on service delivery. So that's what we've picked up in this hospital. We will work with the provincial department, because again we're still picking up the same thing, that the procurement is centralized, especially they've got the threshold of 500,000. Still the issue of recruitment or the employment, recruitment and selection is still centralized. So those are the things which they can relook and make sure that they employ more staff, they create more or they open up the threshold for the CEO and the management, so that when there are challenges, then they can be able to procure speedily. We were told they've got enough PPEs, they don't have challenges. Their concern as well is the issue of space. And we told the CEO that the main intention also for us is to make sure that they provide the tools of trade for the employees to be able to do their work, because what we've picked up in other provinces is that health workers are saying, besides the issue of the PPEs or the quality, you'd find that we are struggling to even take care of the patients. Sometimes you see patients dying in front of you, especially now this issue of the maternity ward here. I don't think you would have a person who will do her work or his work with love and with care when they work under such horrible environment.
Well, since the country moved to level 2, there's been a number of people actually saying their views out there. We actually took to the streets to listen to the people and to hear their voices about what does level 2 mean to them and what they want to see going forward.
I can say they are still adhering because they are still wearing masks. Social distance is observed. But the good thing about level 2 is that now we can visit our families. You can also go to other provinces. And also, go and sit in a restaurant and enjoy your meal with your family.
My problem, I want to know, because of there is no increment of the workers of Department of Health. So if you are infected at the COVID-19, who's going to pay you?
Now let's take quickly at the provincial statistics when it comes to COVID-19. About 24,000 people have been confirmed to have COVID-19 in the province. The recovery rate now stands at 94%, which is a huge number, especially when it comes to this province. You remember only about 7 million people have been screened, and less number of that have been tested for COVID-19. And also we know that the death is around over 370 deaths, and we know that the active cases to this point is just over 1,100. So the numbers have actually been going down for the last couple of months, and the number continue to go down, especially when it comes to the recovery. This province, the Department of Health in the province, saying that the number has gone down because they have managed to actually isolate people who have contracted the disease. They actually managed to go to people who have contracted the disease and and actually isolate the other people that have been in contact with those people and actually screen them to make sure that they don't have the COVID-19, and also to make sure that those people who have been isolated, who have contracted the disease, they actually stay at home and make sure that they actually protect other people. So that's where the number has actually been going down, and the number have been going down since then because they have been working very closely with hospitals. They've been working very closely with those people who contracted the disease to make sure that they stay healthy and they stay away from the streets, and also to make sure that they put out the messages, especially to people out there, to say that people must social distance, people must stay at home. If they don't need to be out, they must stay at home. But we also heard from those voices that we had earlier on, where that we're speaking to the people. People are saying that they're sanitizing, they're actually keeping their social distancing, but also they're saying that, you know what, it's more important to stay at home rather than to go out and have to enjoy your life. But the people here since level 2, we have seen a number of people going out, actually just starting to enjoy their life and starting to break free from the cabin fever that they had for so long. But the numbers here, the provincial government is saying to us that even though we have like a 94% of recovery rate, we cannot stay and say that we are dealing with the COVID-19 correctly, but we still need to work very, very hard to make sure that more people don't get the COVID-19, because at any point there might be a surge. So they don't want that surge in this province, because you remember it's a rural province, not enough facilities to take care of people who would come out very, very sick to go to hospital. So they're saying that they're encouraging people to stay at home, to sanitize, to wash their hands, which is a message that has been reverberated throughout the country, being said by the president, being said by a number of people, being said that we need to stay at home, we need to protect ourselves, and we need to protect other people among us.